Social Security 2026 COLA. What you need to know. A 2.7% increase in Social Security benefits. A double-edged sword? Social Security beneficiaries may see a 2.7% increase in their payments next year, a slight rise from the previous estimate of 2.5%. This adjustment is based on the latest inflation data, which indicates a 2.6% increase in the Consumer Price Index for urban wage earners and clerical workers, CPIW, as of June. Overall inflation has also risen by 2.7%, up from a 2.4% increase in May, while the Federal Reserve aims to keep inflation around 2%. The purpose of a cost of living adjustment COLA is to help Americans keep pace with inflation, ensuring they can maintain their standard of living from year to year. However, many seniors are expressing concerns that these increases are insufficient, particularly as Medicare premiums are rising at an alarming rate. This trend was evident in 2025 and is expected to continue into the next year. Mary Johnson, an independent analyst specializing in Social Security and Medicare policy, notes, "It's not unusual for Part B premiums to consume a significant portion, or even all of the annual COLA, leaving little room for other essential expenses." The rapid rise of Medicare premiums. Medicare Part B premiums are increasing at a pace that far exceeds their historical average. According to the 2025 Medicare Trustees Annual Report, the premium for 2026 is projected to rise to $206.50 from $185 in 2025, marking an increase of $21.50 per month, or 11.6%. This is the most substantial increase since 2022, when premiums surged by 14.5%. For most Medicare recipients, the Social Security Administration automatically deducts the cost of Part B premiums from their benefits. Consequently, a larger deduction means that monthly checks will be smaller. Johnson emphasizes that Medicare recipients often highlight that Part B premiums can absorb much or all of the annual COLA, leaving little left to manage other significant cost increases, such as housing or groceries. Who will feel the pinch? If the COLA indeed rises by 2.7%, which aligns with the average increase of 2.6% over the past 2 decades, and if Medicare Part B premiums rise by 11.6%, those with the lowest Social Security benefits will be the hardest hit. Johnson points out, if the COLA in 2026 is 2.7%, a Part B premium increase of $21.50 would consume the entire COLA for beneficiaries receiving around $800 or less. This is particularly true for individuals relying on low Social Security retirement, spousal, or survivor benefits. Understanding the COLA calculation. The Social Security Administration determines the COLA each year based on the average annual changes in the CPIW from July to September. Therefore, the inflation figures for July will be crucial to watch. The CPIW closely mirrors the broader index released monthly by the Labor Department, although there can be slight variations. Last month, the overall Consumer Price Index rose by 2.7%, while the CPIW saw a 2.6% increase. How many people depend on Social Security? As of May, approximately 74.269 million individuals were receiving Social Security benefits, according to the Social Security Administration. This group includes retired workers, disabled individuals, survivors of deceased workers, and those receiving Supplemental Security Income, SSI. The average monthly benefit was reported to be $1,860.64 in May. Medora Lee, a reporter specializing in money, markets, and personal finance for USA Today, invites readers to reach out via email at mjli@usatoday.com and to subscribe to the free daily money newsletter for personal finance insights and business news every weekday. Bad news for low-income retirees. 2026 COLA may be eaten by Medicare premiums. Prepare for a financial curveball that could leave low-income retirees reeling. The COLA increase might vanish with the hike in Medicare Part B premiums. This unexpected twist could leave many retirees in a precarious position, with their hard-earned benefits being swallowed up by rising healthcare costs. But here's where it gets controversial. Some experts argue that this could be a missed opportunity to address the broader issue of inflation's impact on retirees' quality of life. And this is the part most people miss: the ripple effect this could have on the economy as a whole. In the United States, Social Security beneficiaries are set to receive a 2.7% increase in their monthly payments in 2026, as per the Social Security Administration's adjustment of the COLA. This move is aimed at cushioning the blow of inflation. However, the monthly cost of Medicare Part B must also be factored into the equation. According to Mary Johnson, an independent Social Security and Medicare policy analyst, it wouldn't be surprising if Part B premiums offset the entire impact of the annual COLA increase, leaving little room for increases in other essential expenses like housing and food. The projected increase in benefits is based on new inflation data, with millions of Social Security beneficiaries in the U.S. expected to receive a 2.7% increase in 2026. This adjustment is slightly higher than the previous estimate of 2.5%. And is designed to help retirees cope with the rising cost of living. The latest report indicates that prices for goods and services, such as food, transportation, and utilities, rose by 2.6% in June. Over the course of the year, prices have increased by a total of 2.7%, slightly more than the increase seen in May, which was 2.4%. The Federal Reserve aims to keep the economy stable by limiting price increases to a maximum of 2% annually. However, prices are currently rising at a faster rate, prompting Social Security to make an annual adjustment known as the COLA. This ensures that retiree payments increase slightly, allowing them to maintain their purchasing power. However, the anticipated increase in payments may not be as noticeable due to the significant rise in the monthly Medicare Part B premium. According to a June report, the monthly cost of Medicare Part B will increase from $185 to $206.50 in 2026. This equates to an additional $21.50 per month, or an increase of 11.6%. This hike would be the largest since 2022, when the premium saw an even more substantial increase of 14.5%. Mary Johnson warns that it's not uncommon for Part B premiums to absorb much, if not all, of the annual COLA increase, leaving retirees with little extra to cover other significant cost increases, such as housing or food. The increase in Medicare Part B premiums disproportionately affects those receiving lower Social Security payments. If the 2026 COLA is 2.7%, a $21.50 increase in the Part B premium would negate the entire adjustment for those receiving approximately $800 or less per month, according to Johnson. In May, 74.269 million people were receiving Social Security benefits, with an average monthly payment of $1,860.64. This group includes retirees, individuals with disabilities, widowed or survivor beneficiaries, and those receiving Supplemental Security Income, SSI. The Social Security Administration will determine the final adjustment based on average inflation rates from July through September. Therefore, the data from the next few months will be crucial in confirming the increase. The calculations for the following year suggest a 2.7% increase in benefits, higher than the 2.5% that was previously projected. However, this increase could be diluted by the rising Medicare medical premiums, as reported by USA Today. By 2026, the Medicare Part B premium is expected to increase from the current $185 to $206.50, a $21.50 per month increase or 11% more. This is the largest increase since 2022, when it rose by 14.5%. Consequently, the estimated 2.7% increase in the COLA would be automatically deducted for Medicare beneficiaries, who would see it reflected in their monthly checks. Lower-income beneficiaries would see no change in their benefits. According to Mary Johnson, if the COLA increases by 2.7% and Part B increases by $21.50, beneficiaries receiving approximately $800 or less would not experience any difference. This increase also affects retired, spousal, and widowed beneficiaries, who on average receive a monthly benefit of $860.64. This situation raises questions about the effectiveness of the COLA in protecting retirees' purchasing power and prompts a broader discussion about the adequacy of Social Security benefits in the face of rising healthcare costs. What are your thoughts on this issue? Do you believe the COLA should be adjusted to better account for healthcare expenses? Or is the current system sufficient? Share your opinions in the comments below.